So some of the challenges with implementing care pathways for chronic conditions is that patients that are seeing multiple health and care professionals, and information captured on patients is not always accessible to each of those health and care professionals as the patient moves between them. This often means that the patient has to repeat their story, repeat their symptoms and conditions to these health and care professionals, and it often leads to undesirable outcomes such as repeated investigations, unnecessary admissions into hospitals, and delays in transfers of care. One of the ways these challenges can be overcome is by introducing a digital care pathway. And what that means is you can electronically enrol one of these patients with a chronic condition onto a pathway. That means information will be captured in a much more standardised way across the health and care setting by these care professionals. It also enables you to prompt when certain tasks are due for a chronic condition patient, and it means you can collaborate around the patient's care, which means the patient's more likely to feel confident that you're following their treatment plan. There are several areas within the NHS that have implemented digital care pathways successfully. Two of these areas include both Northern Ireland and Scotland, who have implemented digital care pathways for the treatment of diabetes. For example, Northern Ireland have enrolled all patients with diabetes onto an electronic digital care pathway, which includes both adult and paediatric patients. What this means is data is collected on these patients, such as laboratory results, referrals, assessments, and that information can then be shared with the multidisciplinary teams. There are several other benefits when implementing digital care pathways. Some of these benefits, for example, can include auditing and reporting. What this means is, at the moment, significant effort can be required to create reporting for national auditing and statutory reports if the information isn't captured electronically. Also, information collected in the pathway can be made available to the patient, so things like their treatment plan, their laboratory results, appointments, which means the patient can more collaborate with their care team around their care. And finally, for population health, the information is captured in a standardised way, and what that means is insights can be driven from that data, which can help to improve the prevention and treatment. One of the things healthcare leaders should be doing tomorrow, if they want to implement digital care pathways, is really around engagement. So engaging with their clinicians and stakeholders and identifying any areas which might improve with the digitisation of care pathways for patients with chronic conditions. They should also be looking at their suppliers, making sure their suppliers are committed to interoperability so that technical barriers don't stand in the way of innovation, particularly when requirements and best practices change in the future. And finally, they should be looking at other organisations who have been there and done this journey. So people like Northern Ireland, who have rolled out a diabetes pathway across the whole country. There's lots of lessons to be learned from speaking to these organisations.